Yo, guys, what's up? Welcome to another episode of Happily Whatever After Tips and Tales. आज का जो एपिसोड फॉर रिलेशनशिप्स, ये हम थोड़े भूल जाते हैं, भावनाओं में हमेशा बह जाते हैं. आज का एपिसोड बहुत ही इम्पोर्टेंट है. आई थिंक आफ्टर अ लॉन्ग टाइम हम ये स्टेज पे आए हैं शो that we have called someone very special, very close to us, who has helped us to come to this day today.
Yes,
Yeah.
like we've told in our earlier episodes also. Now we are bringing those people specifically who have helped us heal in our journey, and this is like the best person to introduce to you because she is the one. She is our therapist, guys. This is इनके ही सिखाई हुई सारी चीजें हम अपनी रील्स में डाल के ऐसे चेपते रहते हैं लोगों को कि oh see this is what we learned in couples therapy. So here we have her. Welcome, Seema. Thank you so much for coming today.
Yes.
Thank you so much for inviting me, Karan Shoki. It's a pleasure to be here.
Yeah.
So, to give a quick round of introduction
Yes.
for Seema, she's a clinical psychologist.
Yes, a clinical psychologist. Yeah,
So, for
that's correct.
the way that I introduced to you, so that I can introduce it better, I wanted to also, for our audience,
Yeah.
tell them what is the difference between a clinical psychologist, a therapist, a counselor, or a psychiatrist. So, can you
Okay.
please tell us so that everybody, including us, can understand this once and for all?
Yeah. Okay. So, see, therapist could be like I can also be a therapist. A counseling psychologist can also be a therapist. But the difference between a counseling psychologist and a clinical psychologist is that the specialization that I am as a clinical psychologist, we are equipped or we are authorized to take up assessments for diagnosis of the issue and then create an intervention, customize an intervention which will help the client.
Hmm.
So that includes therapeutic intervention and also if required, if it's severe, if it requires a medication, then we will be referring to the psychiatrist. Where psychiatrist comes in the picture is the psychiatrist has the degree of obviously gone through all the medical degrees of MBBS and DPM, where they have specialized in psychiatry and they are authorized to give medication. So it's like they are generally earlier they would not be giving therapy, but these days even psychiatrists would like to know a little bit of therapies because when clients come, they would like to talk to them about their issues. But we are not authorized to give medication. So we are only authorized to, we can give therapies, different kind of therapies to tackle the client's challenges. And as I can do assessments, and psychiatrists will send the clients to clinical psychologists for the assessment. For an example, if you feel that you are the psychiatrist feel you have low mood or you're undergoing depression or anxiety, then they will send the client to a clinical psychologist or like me to have an assessment done to know what is the severity or what is exactly where the client is at. So accordingly, whether the client needs medication or only the therapy would work or a combination of therapy and medication. So counseling psychologist will is authorized to give therapy I mean deal with all the mental health, emotional health issues definitely, but not assessments.
So,
So I hope that brought a little clarity in all the three.
Yes.
yes, I was also going to tell our audiences about Karan's example because we first went to a psychiatrist when Karan used to have prolonged low moods and
Yeah.
years of feeling low every few days.
Yeah.
So first we went to a psychiatrist.
Yeah.
Basically, the first step was for him to diagnose Karan, for which we were sent for a, like you just said, extensive tests
Yeah.
Correct.
for the diagnosis. And when he got diagnosed with dysthymia, which is like a longer form of depression, is when he was also prescribed medications. And then after a few 1.5
Yeah, after almost, I think it took me a year and a half to come to this point where my moods were getting better. Though I was on antidepressants, I think after a certain time, I needed someone who can help me out with my thought
Yes,
process, where you came into the picture and helped me out.
yes. So definitely, a therapy, if you have severe depression, then medicines help for you to come to a point where you can understand that there I need to work on my thinking, my behavior, or what is on my thought process, basically. So
Mm.
it is again, if it is severe, then you will need medication to come to that point. So a
Okay.
combination of therapy and medication would work at this time. But at the other times when it is only moderate and all, then therapy would be fine.
Yeah.
Okay.
And
So
also this is a good point for us to tell our audience that there's no stigma attached to medication or therapy for that matter. It's good for
yes,
you and
and
your health.
definitely a new age medication. It's not like earlier times you used to say that एक बार दवाई शुरू की तो वो कभी खत्म ही नहीं होगी, ऐसा नहीं है. Nowadays, new age medicines, I know of clients where they've been prescribed when if they're too anxious. So whenever they're anxious, so they can just take it for some time and then leave. Definitely under the according to the doctor's advice and discretion,
Yeah.
not to do take it by yourself or leave it by yourself.
True,
Yeah,
true.
true, true,
Yeah.
true, true.
That's what I think we did with Karan also.
Yeah,
We like
Yes, definitely.
yeah,
he took it for 1.5 years and then
Yeah.
slowly we weaned off
yeah.
with the doctor's help,
Help.
obviously,
Yeah.
and your invaluable inputs.
Yes. I think what happened in the most of thing when while we are discussing is right now I can clearly see that stage one was I was not able to actually understand what am I going through in the first stage, because
Absolutely.
there was a cycle which was continuously happening with me. I was in a loop which used to make my mood swings go up and then go down, then go up and then go down. I remember there was a time where uh, I used to get up in the morning, my brain used to run at a speed of 100, and there were days when I was happy, when I was like okay, and there were times in the day while I was just sitting and suddenly I used to become so much anxious that I wanted to do 200 tasks as one given point of time. So those were the feelings, and it was a really overwhelming time for me. And this, both the things, whether it was the antidepressants or the medication, I think together. It took me some time, but yes, thank you for helping me out to come to this journey. So,
So on that note, Seema, I wanted to ask you, like, it was a very common belief between me and Karan also that ठीक हो जाता है ना थोड़े दिनों में, तो क्या जरूरत है, मतलब थेरेपी की क्या जरूरत है,
Yeah.
and which kind of was counterproductive for both of us, and Karan
Yes.
reached a point where it was severe. So
Mm.
people believe that therapy तभी लेनी चाहिए जब एकदम serious mental health issues हो जाए. So can you explain this, and can you express your opinion on this, and how can we encourage people to do that?
Yes, and before doing that, I will just like to tell you that yes, with like Karan and you said that medication से तो ठीक हो ही जाएगा. But the thing is with medication, they will reach you at a point, okay, when your mood is not that extreme, right? But to understand that why is it happening and how do I improve and sustain that
Hmm.
in the future? So that medicine will not do that. You need that work, to undergo that. Of course, we'll be talking about it more deeper on a deeper level also. So, to give your answer that the psychotherapy is only for very serious situation. That's a definite misconception, because therapy can equip you with tools to live a better quality of life, and as you must have experienced yourself, right?
yeah,
A more meaningful, more purposeful, more happy, healthier life, right? So yes, it has a vast range of issues that therapy can take care of or support and guide you on that. like you said, stress, anxiety, mood disturbances, some kind of grief, trauma, abuse, anger issues, or you're navigating your day-to-day challenges also, and your life transitions, even the good ones, getting married or having a baby or shifting to a new place or a new job or even a promotion. So that can kind of, overwhelm you with a lot of different feelings which you're not able to manage. So that is the time you need some kind of support and guidance. And then if you even for your if you're feeling uh, low self confidence, low self esteem, you know or even we can support you and guide you towards self exploration, self awareness, motivation. We can guide you in accomplishing your personal and professional goals. you know so it's a plethora of it's a very vast range, not necessarily only serious issues. Your emotional management, time management, for that matter, a lot of people will become, I'm not able to manage my time. So these are the skills, effective communication skills. So
Mhm.
different skills people come for, not only for. So it is like we are equipping you with supporting you, guiding you, right, rather to keep all the dimensions of your life healthy and balanced: physical, mental, emotional, social, spiritual. So there has to be a balance between all of them, and therapy
Yeah.
can help you with that.
And this is something that we keep telling our audiences, that जैसे हमें बुखार होता है तो
Ah,
डॉक्टर के पास जाते हैं ना. So that's fine. You can, like, if you're feeling low, you're not feeling okay, आप ऐसे थोड़ी ना वेट करोगे बुखार होगा तो खुद से ठीक हो जाएगा, गला खराब होगा तो खुद से ठीक हो जाएगा. You go to the doctor, you consult him, you take whatever medication therapy he advises you to. So similarly we can do the same for our mind, for our
absolutely.
mental health, apart from the physical health. So
Ah,
very
definitely.
important.
And mind and body are part of you as a whole, right? So we
True.
just focus on the body more than the mind,
True.
right?
Yes.
So we need to take care of our mental health as well as our physical health, because people fail to understand that mind and body, they're always connected. You cannot be healthy if one part of your body or your mental health is not
Yeah.
functioning at an optimum level.
True.
Okay.
True.
So I remember, Seema, when I came to you, there were a lot of issues that I had with myself after going through medication. Correct. A lot of time, people, as we have discussed, that you have plethora of things. When we go to therapy, it might be anxiety, it might be time management, it might be mood swings. There are multiple things that a person goes through, and people really think that therapy is just about talking and holding those beliefs, and there is no genuine resolve to that. What is your thought on that? If you can guide the audience on that how does a therapy happen? For me, I obviously have gone through tremendous changes, but I would like you to throw some light on those lines.
Yes, definitely. And I was about to say, yes, we have live examples, isn't it? So, yes, so therapy is not just talking, definitely not talking. As we know, that first of all, it's a um, scientifically validated process, right? So, we are using science, I mean, it's based by evidence, where and according to American Psychological Association, 80% of the people lead a better quality of life and see a positive change in themselves who take therapy rather than people who require and they don't take, right? So therapy is a collaborative process first. It's not the therapist talking and the client listening. Definitely not. Because both of us have to work. If the client also has to put in effort, a lot of people will ask, Acha, ek session mein ho jayega na? I said that it's not a magic wand. So I'm sorry, but it is not like that. So accordingly, then people will ask me when they're inquiring on the phone, अच्छा कितना time लगेगा हमको, 2 session, 4 session. I said, I really cannot say. Because in the first session, I need to understand the concerns and definitely the amount of work required and the efforts which are put by you and myself. If you give your 100%, I'll give my 200% to it. And it's definitely, my sessions would always be interactive and experiential. I would be giving homeworks, tasks, and teaching you techniques and tools to implement in your day to day life. So you yourself can experience the change. And you yourself will come next time and tell me, oh, wow, I was able to do this, which I have not been able to do. And that gives you confidence and that motivates you to continue. And that is why the intervention is always customized, because there's so many approaches to therapy, not only one. So again, for each client, after the first session, then we need to decide, or we see which would be a better fit and at which stage do we need to use this approach. It would be a mix of approaches. So definitely it's not just talk, it's a lot of hard work from both the sides, and it's
Yes.
a definitely active participation from the client
Yes.
Yeah,
and the therapist. It's not just talking.
I think
so
my takeaway with your sessions was that please do take notes every time we go for a therapy session.
and also I wanted to tell our audience that it was not at all that कि एक ऐसा ग्रे सा ऑफिस है और एक काउच रखा हुआ है जो हमने यूजुअली मूवीज में देखा है ना कि
Yeah.
ऐसा बिल्कुल डार्क डिंजी टाइप की चीज दिखाते हैं थेरेपी कैसी होती है या फिर एक काउच दिखाते हैं जिससे लोग ऐसे रोते वोते रहते हैं बैठ के so it was very fun guys when we first met Seema firstly she met us at a cafe
Yeah.
and it was like actually chatting up with an old friend
Yeah.
that आप अपनी सारी राम कहानियां बता रहे हो कि अरे देखो मेरा इतना लाइफ खराब हो गया है and she was very very open to hearing both the sides with Karan also with me also and from after the initial few stages, I think we both started looking forward to it. Instead of thinking it as a oh बहुत दिमाग पे pressure होने वाला है therapy session है, we used to look forward to it because Seema used to give us some really fun quizzes to understand our attachment styles, our love languages, our problems, or the way we solve our problems. So uh, I just wanted to tell them that it's not just sitting at one place and talking to the therapist and then therapist judging you. That is never going to happen in any therapy session. So with Seema, it was as easy as sitting in a cafe and chatting with a friend and doing some fun quizzes. But there are also other therapies that she's talking about which can be helpful. So could you give us like a snapshot of a few of those therapies other than talk therapy?
Talk therapy, meaning like in talk therapy also there are different approaches I'm talking about,
Yeah, that's what I
so it is like CBT, like cognitive behavioral therapy, or REBT, rational emotive behavior therapy, or ACT, acceptance and commitment therapy, or behavioral therapy, or person centered therapy. So there are many therapies or approaches, DBT. So according to the person's concerns and their, of course, we come to know that a person's strengths. So according to their level of understanding, growth, maturity, then we need to apply. It's like एक नर्सरी के बच्चे को आप सेकंड ग्रेड की का इंफॉर्मेशन नहीं दोगे, right? So rather, and a person who is on in the 10th grade, you're going to give them a higher level information, right? So according to the client's concerns and their where they are at currently, we need to use these approaches, so that is why it is customized, whether it has to do with only their behavior, whether it has to do with their thought process. Are they grieving? So that time they just need support to just be there, listen to them. So that time we just need that kind of support. So it's a different set of approach every time.
Yeah, yeah. So this brings me to another question, Seema, that uh, often most of the people in relationship feel that therapy is the last resort in the relationship, or you go to the therapy when you are at the brink or the end of the relationship. How do you see that talking about or benefits of therapy if we take early in the relationship before it reaches the end of the relationship? So how does that part of
Like
therapy helps?
when I was researching this podcast and questions for the podcast, I found out that most couples usually go 6 year late to the
Okay.
therapy than what they should have in the initial period. So can you tell us about some benefits of going to therapy even when things are not wrong?
Yeah, or starting to get wrong and you feel like where we started,
Like
uh,
prevention is better
then
than
cure.
cure.
A stitch in time saves nine. We've all heard of that, isn't it?
Yeah.
Yeah, yeah.
The thing is that if you wait too long, or there already so much of negativity, that hurt, deep seated resentment, and negativity, already so much of water has passed over that you've already decided that a lot of damage has been already done. Then you've already decided that somewhere we want to part ways, or you're looking for divorce. So at that time, it is already because your mindset has been already very negative at that time. So what happens when we're talking about approaching a therapist earlier? Because see, what happens during courtship, you are always at your best self and you're trying to woo that person with all the goody things and the fairy, and we have always seen the movies, we get all influenced by it's going to be a fairy tale romance, and after marriage we're going to have this kind of life, just like in the movies and all. But that courtship period is very beautiful. No, no, I mean, no, without any doubt. But after you get married, you start to coexist. You're not only meeting for just a little amount of time that you're at your best self. That time you cannot be at your best self all the time. That is when you are a real person. I mean, staying together 24/7, where you realize, okay, acha, ye आदत भी है. Okay, now this is also a habit. Acha, ऐसे भी है, that you won't know that what are the different habits, the way they live, the way they talk, or what they really like, and different belief system, different ways of dealing with challenges in life. So that is the eye opener. That time, and there's a lot of change that both the people have to face, isn't it? See, again, you're in your comfort zone when you're not married. You are used to your ways of thinking, behaving, getting your ways. कैसे करना है, क्या करना है, you're not answerable to anybody, right? After marriage you feel kind of, I think both the people get overwhelmed also with all the change because there's so much of adjustment. I mean, there of course adjustment with each other, then communication. So sometimes you again with trial and error, or you have to see whether you, most of the times you feel, अरे पहले तो everything was fine, after marriage suddenly what has changed? I mean, कुछ ऐसा लगता है as if I don't understand him, he doesn't understand me at all. पहले तो इतना लवी दबी था, अभी क्या हो गया? So it is like these are the natural things that happen. I mean, people feel, the couple feels that way. So adjustment with each other, their habits, their communication, then adjustment with the families, right? If you're staying in a joint family, adjustment with the in-laws, right? And then adjustment in your with your friends, with your spouse's friends. I mean, social obligations, family obligations. Then again, your household workload, right? Now that needs to be taken care of together also,
Yes.
right? So a lot of finances, there are a lot of things which need to be taken care of now, right? So all of these things, I mean, they can overwhelm you, definitely, right? So that is the time then when you start arguing with each other or blaming each other. Okay, you are doing this, you're not doing enough, or if you had done this, things would have been okay. So instead of you only focusing on what the other person is doing, isn't it? So again, I think at that time, it helps to go to a therapist because you both don't have the skills to deal with these things because it's new to both of you. So again, you need to learn these skills, right? So you need to learn effective communication skills. You need to learn effective conflict resolution skills, setting boundaries, isn't it? So these are the all the skills how to manage your, I mean, not to get overwhelmed, isn't it? Your intimacy issues or whatever it is. So you need to learn a lot of skills, and therapy can really help you and guide you with that at that time. And that time, couple is more receptive to it also because they want to try. And generally people would say first year is challenging, but in my opinion, 2 3 years are challenging, not only the first year. It does take time to adjust to different, I mean, aspects of your
And I
married
think
life.
we can vouch for it because after 4 5 years of marriage, now we can say this is
Yeah,
the best version of
Ourselves in the
ourselves.
relationship.
correct, correct.
Yeah. So, Seema, which brings me to a very interesting question, right? As you told that key people, at least in India, right? Because therapy in India is sort of still a taboo, which we are trying to, break in. That is our main motive agenda. That therapy is just help. You are asking for a help, you're asking for, a doctor when you have fever or when you are not well. So, what are those common issues that couple brings in therapy, like generally a lot of times you might have dealt with a lot of couples. There were me and Shoki. When we came to you, I think one of the larger issues that we brought in was you, that कि हम दोनों एक दूसरे को समझ नहीं पा रहे थे 4 या 5 साल के बाद भी. There was sort of different personality which we came to know as we processed in the therapy, that what kind of a personality Shoki is and what kind of a personality I am, and how do we interact with each other so that we communicate better and we solve the issues. So when you
So
uh,
do you see any common patterns that are every other couple has? So that why we are asking this question is also so that our audience feel less alone in their misery that
Yeah.
there are more people with the same issues.
I think it is, I mean, pretty and common to a lot of relationships. And as we always say, the first and foremost, poor communication skills, or there's a communication gap or a communication barrier, which all the couples feel, and they feel that I am not being heard, or they're not able to express their feelings or their needs to each other, so that there's somewhere there is a barrier between them. So we need to, that communication barrier. So we need to definitely address that. So that is a number one, I mean, first and foremost. But also, definitely there's also emotional disconnect. So when that you feel that you're not, there is no enough sharing of or expressing how you're feeling in a situation. There is no emotional intimacy. So you don't feel that close enough now. Earlier, बिना बोले ही एक दूसरे की बात समझ जाते थे. अभी तो बोल के भी नहीं समझ में आ रहा है. It's like that. So definitely there is some kind of an emotional disconnect, so that you tend to fill that void outside. Then again, even I feel that I'm just telling you generally what are the
yeah, yeah.
common issues that not in any sequence, but communication was number one, definitely. So again, there is, if you're not committed enough, you're not respecting the boundaries of your relationship, right? So that is when you are okay, chalo theek hai, chalta hai. So that's why you're just straying, your per se, or long distance marriages.
Yeah, that's a very big.
So when long distance, there's no physical intimacy, there's no, it's only through digital medium, there's no personal interaction. So
Yeah.
that kind of really affects, you've become lonely. right? So to fulfill certain needs, then you look for it elsewhere, Then these days, what I'm noticing, which is really causing problems between couples, is one of the persons indulging in too much of digital gadgets in
Oh,
their personal time. This is a new one, I mean, I'm generally hearing this from the women
yeah,
in the
true.
relationship, that
Yeah.
even after in their personal time, that they're just binge watching or gaming or on their mobile all the time, and then there is no limit to what time, and then of course there is no communication between them. It's eating away in their intimate their personal time, and then the other person is feeling neglect. There is no connect, right? So again, that is also one of the reasons these days, which
Yeah.
I'm hearing quite often.
Mhm.
So yes, and then again, not like I said, not respecting the boundaries, or you are, allowing the other people also, allowing external influences to come into your relationship. It's like entertaining too much outside, or
Hmm.
calling up too many friends all the time,
Hmm.
or maybe
Hmm.
family also. So where is the time
Hmm.
between you all,
Hmm.
isn't it?
Right.
So again, just seeking. A lot of people would say that, I mean, these are the like what I'm talking about was also about straying, kind of, it helps in not straying. But yes, these are the main things, like even physical intimacy. I talked about emotional intimacy, even the physical sexual intimacy,
Yeah.
which is
Hmm.
kind of, you know,
An issue.
Yeah.
Okay.
yeah.
Okay.
So, so now this brings me to my first and foremost thing that Karan and I have also started preaching, if I would like to
Hmm.
use that word on the podcast, was that हमारे सारे प्रॉब्लम्स ही इस चीज से हुए कि हमने कम्युनिकेट करना बंद कर दिया. क्योंकि
Mm.
शादी के पहले तक जब तक हम सारी चीजें बिल्कुल डिटेल में एक दूसरे को पूरा दिन बताते थे, ऐसा हुआ वैसा हुआ, पूरा अच्छे से बातचीत करते थे, एट दैट पॉइंट ऑफ टाइम थिंग्स वर ओके. But then the moment we got married, the communication, uh, it didn't stop, I would say, but it became more complicated because there were other factors involved. So, uh, like you also said, the very first issue, the most common issue is communication. So, would you, like you gave to us, would you like to give some nuggets of wisdom as to how this is a very basic thing, but how at their own level, in their own life and everyday issues, how can couples work on their communication?
So of course, in the therapy, like, see, again, for them to work, I need to observe, understand their communication styles first, right? So that itself begins in the therapy.
Yeah.
See, first of all, when they come, suppose they've come with some issues, right? So just to give you an example, and even in the last question that you had said, the common issues, one thing I forgot to mention was unrealistic expectations from each other.
Yeah.
That was also a very big one.
Yeah.
So again, unrealistic expectations in every, what you should do, what you shouldn't do, or
Yeah.
so there are a lot of expectations which are not fulfilled, and you
Can you
feel.
give us an example of, so just because people should have a reality check of what is unrealistic?
Don't you think Var was the biggest thing? She was like a Bollywood buff. She wanted like a romantic thing. Karan इतना romantic हो जाएगा. आज भी हम झगड़ते हैं उस पे. But yeah, I mean, that's the biggest. I think Seema started the episode with saying this, that what is being seen in the movies are not the real life stories,
Exactly.
or yeah. So,
कंपैरिजन विद द सोशल मीडिया. अरे उनका लाइफ मेरे लाइफ से बेटर कैसे है? It
Yeah.
is like, अरे they're traveling so much, and look, and that is social media, and then you're comparing yourself with other couples. Look, her husband behaves this way, look, his wife behaves this way, you know so that is I mean, those expectations. Why don't you are so lovey-dovey to me, or why don't you do this, we don't go out so much often. Oh, workload, attitude also, for that matter. Either you're expecting one person to do a lot of, take care of a lot of things, or even one person expecting the other, even, doing things their way. Everything should be according to how they like it, isn't it? And
Yeah.
then expecting the other person should understand what I want without me telling them, or without them asking. It's like mind reading. They should be able to read my mind. Suppose if I am not asking them to help, why aren't they helping me out?
Yeah, that's the biggest one actually, something that we
Yes,
also receive on our podcast. That
yes.
उनको समझना चाहिए ना what.
समझना चाहिए अपने आप. So without even explaining. So
Yeah.
these are expectation, not realizing that yes, probably the other person is not realizing that you need help. If you need help, they're expecting you'll ask.
Yeah.
Yeah.
Then
True.
there's this ego. Why should I ask? They should help themselves, right?
Yeah.
So these are the things which are very common.
Yeah.
So these you have to kind of calibrate, or you have to, in therapy, that's what those realistic expectations need to be, mentioned or understood,
Yeah.
that what is realistic and what can I do.
Yeah.
So
Yeah.
is there a tip that you can give us about communicating better at
Yeah,
home?
yeah. Communication. We were talking about communication.
Yeah.
Sorry. Yeah. So communication, like I said, okay. So when a person would probably see, they would not come exactly for that. We need communication skills.
Yeah,
No,
yeah, that's for
they
you
would
to.
come that
Yeah.
like as a couple is coming and they have issues, and then first thing. So I'm telling you the structure generally, that what I generally do and
Yes.
how I come to know of
Yes.
probably their issues, and how do I point out, okay, this is communication skills I need to work on. So when they come to me, of course, after the initial details and all, then I would ask each of them to talk about their concerns, share their concerns with me, right? So obviously each person would start, somebody, the other person would interject, and also again, so that is okay. But when once they explain their concerns, then I tell them to write them down, right?
Hmm.
So the same concerns that they have talked about, then I would ask them for a lot of examples for whatever they have just told me, because how would I know exactly?
Hmm.
So with their personal situations or instances that have happened, so a lot of examples, and through those examples, when they start telling me examples, I can see that communication right there and then. See what is happening, the way they're communicating, the way एक दूसरे को किस तरह से टोक रहे हैं. I can see their verbals as well as their non-verbals,
Hmm.
Mm.
because we are trained to observe
Yeah.
behaviors, and
Yeah.
so I mean, and as we know, our non-verbal behavior, non-verbals are, actions speak louder than words. So
Yeah.
our even 55% of our communication, non-verbals, they're conveyed through our non-verbals,
Mm.
right? So I would see how they rolling their eyes, or they're, with their gestures, or shrugging, or raising their eyebrows, and smirking or whatever. So it's a real live, so I can observe firsthand their communication pattern, and how they're getting aggressive, or so I get a little idea about that. So definitely I keep on asking more examples, then I ask them about their triggers. Of course we need to, and from that communication, their examples, we are getting certain pattern out of, you know so again I'll ask them for their triggers, that what is it that triggers them, when this thing happens. There's something has to happen, there has to be a cause and effect, right?
Hmm.
Mm.
So
Yeah.
what triggers them into these things? So with their, again, they would be giving us examples, and they'll be writing about it. So you get a fair idea of the patterns, the kind of belief systems they hold, the kind of conditioning they've had, or the limiting beliefs they're holding, or some kind of unresolved issues they're holding on to. So you get a fair idea. So of course I talk. So then before going ahead, then I generally explain these things to them, definitely. And then I give them task also then. for the next session. Like first of all, again, if we are not aware, first of all, they need to be aware.
Hmm.
So even while communication, generally we are always on auto mode. We don't
Hmm.
even stop to think, right?
Mm.
That so because we are so used to speaking this way, so
Hmm.
we're on auto mode. We react. We don't respond. So
Correct.
between the stimulus and the response, there's always a space to choose your response. We don't take a pause.
Hmm.
Taking a pause is extremely, extremely important,
Mm.
and that will only happen when they're aware, when they're made, when your
Hmm.
mind is trained to be aware, right? So I
Yeah.
that if I am, there's an argument or there's something and I'm about to say something, or I feel anger rising in me and about to say something, that is the time to take a pause
Yeah.
and
Yeah.
check yourself.
Yeah.
That's a boundary you're about to cross where is there's no returning back there,
Yeah. Yeah.
right? Then
Yeah.
that is what, when things will go out of hand, that is a time to take a pause. So these are just nuances of communication, right? So in that, definitely I give them homework, that okay, till next time you have to write the situations which uh, will cause you probably a little bit of distress or argument, and what your thoughts and feelings about it, and what are the triggers, and
Hmm.
no criticizing each other, no judging each other for a week at least. And if you are just out of habit, you're like you're about to say something, just hold yourself back. At least that much you start doing and noticing, taking a pause and listening to each other.
Mm.
See, a very big part of communication is listening skills.
Listening. Yes.
Yeah.
That is why they don't feel they're not being heard. Because
True.
listening is like when they say I'm talking and the person is on the mobile or distracted, looking at the TV. So that time you need to be absolutely give undivided attention to each other, and just just hear them without any distractions, without even cutting them off. A lot of people will say we're just cutting them off.
Yeah. Yeah.
So when you cut them off or you don't let them finish, so that's an energy that we are sending, is that you're wrong, I am right, and it's energy of being rejected somewhere. But when you're hearing them out, and then okay, then you're probably asking just questions to clarify, even if you don't agree with it, the energy you are sending is okay, I understand you, you have a different point of view than mine, but
Hmm.
Mm.
it's okay. See, one person to be right doesn't mean the other person needs to be wrong.
Mm.
We need to understand both of us could be right with different perspectives, different point of views. So again, that accepting that there could be a different point of view than mine
Hmm.
also, right? And it's okay. Both of us are right. Okay, for this situation, maybe both of our viewpoints will not work. So let's see. Let's just sit down and see what will
Mm.
work.
Mm.
Yeah. Yeah.
Lot of factors of communication skills, then again conflict resolution skills, because that's also part. If you know how
Yeah.
to communicate with one person, then you will deal with conflicts also in a better manner.
Yeah.
And with your non-verbal, the tone of your voice also matters a lot. It's not what you say but how you say it.
Yeah.
Yeah.
Tone, pitch, volume of your voice, right? And then are you in any kind of a talk, do you raise your voice, you become aggressive? So that is like aggressive, your communication style, right? That wouldn't work in the long run. Then
Yeah.
passive, are you too passive? Then you're getting suppressed and feeling, oh,
Hmm.
I'm being suppressed all the time. So the best way is to be assertive. These are the
Mm.
skills then we can teach them, or they can learn in, we can go over them in the session. So explaining to them, in the next session maybe, that when they come back with their assignments and all, okay, so we'll work on them.
Hmm.
And with a lot of role plays, I love that part. We can do a lot of role plays with the situations. Okay, let's enact out that situation which happened
Hmm.
earlier, and how can you behave differently this time
Mm.
if you're
Yeah.
equipped with these skills, with keep being more aware.
Mm.
So this is also because you're training your mind to act in a different manner, right? So that also, then they also know, that, okay, there's a different way of dealing with the situation. And both of them, with a lot of homeworks, tasks, writing, role plays, that really helps. Practicing pause, definitely.
Hmm.
And then their styles, if they have an aggressive style, if they have anger management issue, and an individual level, then I will deal with them. I would be, that also affects a relationship a lot. If you have your individual emotional blind spots, or
Yeah.
you yourself are going through some kind of unresolved conflicts in your life or
Hmm.
issues, that also affects your relationship.
Hmm.
So at then I need to work with them on an individual level, which automatically, your relationship becomes better because you understand,
Hmm.
Yeah.
right? And most of the time, what happens in the relationship, everybody is focusing on the other person, what the other person should do.
Yeah.
They should change,
Yeah,
Always.
always.
Yeah.
right? So then,
Internalizing.
through therapy, you come to know I cannot change the other person.
Yeah.
I need to work on myself. Both
Yes.
of us need to work on themselves.
Yeah.
So then the outcome will be, both of you will be changed,
Yeah.
Yeah.
and the relationship will change. And
Mm.
most of the time, they're focusing on things which they cannot control. Again,
Hmm.
you need to do this, you need to do that, But I need to focus on the things that I can control,
Hmm.
which are in my hands,
Yeah.
instead of focusing on what the other person needs to do, pointing fingers at the other person,
Hmm.
Mm.
right? So that is also, so these are small things, but very important, which needs to be, learned. And I try that in the sessions we take it up, so at least they are equipped with effective uh, communication
Hmm.
tools, so they can, and that really helps in developing that bond, and being understanding each other, of course,
Yeah.
and accepting each other with their different viewpoints, and not rejecting that my way is the only way.
Yeah.
Mm.
That is very, very important. So when they get newly married, that is the case generally. Is that my way? I've been doing this all my life and it's
Yeah.
worked. Why should I change and do it differently?
Yeah.
Why can't you do it this way?
Yeah.
Yeah.
So
Also, this is one of the most common things that we receive as a uh, as questions or as issues from our listeners, that
uh,
a मेरा पार्टनर चेंज, मैं अपने पार्टनर को चेंज कैसे करूं,
hmm,
एंड बी मुझे जाना है थेरेपी, बट माय पार्टनर इज नॉट रेडी टू गो. सो चेंज तो वीव ऑलरेडी आंसर्ड.
yeah,
You have to start with yourself, changing yourself.
absolutely.
But what do we say? What do you say to those couples where only one partner is ready to come to therapy or sees the need for therapy, but the other one is not ready to do that?
Actually, then see, first rule of therapy, you cannot force therapy on anyone,
Yeah.
right? A person needs to be willing. So many times, a mother would call and say, okay, my daughter or son needs therapy, but not willing to come. I
Hmm.
said, then I cannot help. Either you have to convince them to come, then you cannot force somebody,
Hmm.
Same with the couple therapy. I have inquiries like that, like, okay, my husband or my wife is not ready to come.
Hmm.
How can you help? Say, I cannot help them, both of you. I can help you in understanding the issues better, or if you are willing to come, what you are going through, what are your underlying
Hmm.
issues, if you are getting overwhelmed, uh, if you're blaming yourself, or there's some kind of, with your relationship, you're victimizing yourself, or you're, so then we can work together in
Mm.
managing your emotions and empowering you, right? So therapy is generally all about, from taking you to feeling like a victim
Hmm.
to a winner. You are empowered to make your
Yes.
own decisions in life. So
Mm.
if you're in relationship, you feel as if you've been victimized, or you're not able, you're feeling helpless, then
Hmm.
yes, we can work on those issues with you on an individual level. But as a couple, I cannot, because I have seen in when I can make out when the couple is coming and the husband is very quiet, not saying anything. So I guess that this person has come forcefully. I mean, the wife has brought him nothing, and with their body language, and then I can make out that they're not going to share, of course, unless and until you are honest, you share what is your concerns. A therapist cannot help you or guide you. So I know that they're not going to come back for the second session, because obviously if you don't open up and the wife is talking, I cannot help, and the issue is between the both of them,
Yeah,
then they cannot be helped.
true.
True,
They
true.
don't want to be helped, we cannot force them. Then it's a
So,
journey they have to go through. Probably at a later time they will realize that, okay, I need
yeah,
to go to therapy.
yeah.
Yeah.
So
But
that's
it's
okay.
still okay if the partner who's ready to come to therapy should come so that they
Yes,
can
because I'm sure
understand.
when a relationship go, I mean, obviously there are issues in the relationship. It affects the individuals also at that
Yeah.
level. You undergo a lot of, I mean, emotional turmoil also.
Yeah,
That time you need to handle yourself, like not victimizing yourself, or not. Sometimes that self blame also comes. Okay, am I not good enough? Have I done something wrong that this is happening? So we don't
yeah,
want you to feel that way.
yeah,
So it is important to deal with these issues and not feel helpless that you are a
hmm,
victim and you cannot do anything. We always can do something. We always have a choice.
Mhm.
Always we have a choice, right? Not choosing to do something is also a choice,
Yeah.
isn't it?
Yeah.
So again, we in therapy we do empower you enough to so you are able to make your own decisions and choices and take responsibility for the consequences of those choices.
yeah,
Yeah.
If they don't turn out the way you want them to, then okay, I'll go make another choice. It's okay. But
hmm,
yes, I did that. I am responsible for that. I am taking accountability. I am accountable for that.
Yeah. Yeah.
That is being empowered, that it's okay to make mistake, it's okay to make wrong choices. We can learn from them, right, and not feel victimized.
yeah,
Yeah.
So yes, even one person comes and if they we can work at an individual level, that will be helpful.
yes.
Yes. Mhm.
Speaking of all the issues that we encounter with our audiences, the other burning issue is the issue of infidelity or some kind of a breach of trust.
Mm.
And it ranges from something as small as कि उसने उसकी फोटो लाइक क्यों करी on social media to a real infidelity, that having an affair in the office with someone else, having an emotional affair is something that is very common, instead of a physical, and they somehow try to get away with it, that
Hmm.
what is the big deal, हम बात ही तो करते हैं, type thing. So if
Hmm.
you could explain to us that how is it possible for couples to get over such issues, or it's a final nail in the coffin in the relationship, or how can we help, how can therapy help?
सो इस इनफिडेलिटी के क्वेश्चन का आंसर जानने के लिए मिलते हैं नेक्स्ट वीक. अंटिल देन प्लीज डू लाइक शेयर एंड सब्सक्राइब. चेक ऑल द सोशल मीडिया लिंक्स बिलो इन द डिस्क्रिप्शन. सी यू गाइस. बाय बाय.